So I've been asked to just give a background really to the subject. And I just wanted to put the context really. It may seem a little bit academic, but then it'll be followed by very practical examples related to loneliness and so forth. The pandemic, of course, has a disastrous effect on life in Europe and elsewhere, of course. But what it has done is it has shown up the cracks in the system. What we thought were resilient systems turn out not to be so resilient. And one of the impacts on life in our society has been that there's been an increased awareness of loneliness and isolation, not the least because of the measures that have had to be put in place. So we'll come on to that, but we want to provide this context. European Health Futures Forum is an organization that promotes change, we hope change for the better, in European health systems and well-being systems. So we support the idea of moving services from hospitals into the community, on focusing more on prevention than healthcare. Certainly the balance is very tilted at the moment. We look at things like having well, active role of citizens and communities in managing healthcare more than there is now, on providing digital tools which are designed by the users as well as the suppliers of these things to make them more effective, and look at the wider elements that impact on healthcare, such as the economy and the environment and so forth. So it's natural for us to be particularly interested in community empowerment. This is a peculiar kind of joke. It's about what community empowerment isn't. So what this gentleman from the government, you can just see he's got a badge that says government on him with the books, is saying to these hapless members of the community is, we want communities to own the big society. We want you to feel it belongs to you. We want you to have ownership of it, to be responsible for setting it up. And here's how we want you to do it. So that's paternalism writ large. I'm afraid that is what happened during that particular period in the politics of the United Kingdom. But the fact is, although that was 10 years ago, things haven't changed that much. Just today, for example, although I'm quoting in my slide something from WHO Europe, a report from 3 years ago, and a conversation that took place last week, just today, Hans Kluge of the WHO Europe was saying in the press, we're suffering in Europe from COVID fatigue. And one of the ways to combat that is for there to be a better dialogue between societies and governments. And so it's a repeated message, which we think is really important, because the fact is it's not happening properly. So although as I say on the slide, in 2017, they were promoting such an idea, the fact is under the pressure of the pandemic, simply people have gone back to their default position of the paternalistic mode. So although in reality, in communities around Europe, there are initiatives that are bottom up and have made a difference in local communities, they're not recognized or acted on by governments. And indeed, governments have refused to have dialogue with local authorities. And I mentioned specific examples from France, Portugal, and the UK. So going back to the origins of the idea of empowerment, people feel really that it started more than 50 years ago in the 60s, although there may have been things before, but the notion of power to the people was something, when I was a a young student, it was very much the word. It's not just a slogan. Uh, the key elements of empowerment is the notion of, and it's still absolutely true and true in relation to healthcare as well as other things in society, the principle of choice over issues that affect your life, your autonomy, and the idea of proactive involvement. And that's very much the theme for patient and citizen empowerment. The manifestations, when it first started, were movements in pursuit of social justice and civil rights in the areas that were obviously people had been deprived in the past. So the women's liberation movement was a natural one because of inequality there, and the Black Power movement similarly. And this led to an increased awareness of the importance of a shift towards a bottom-up process, giving voice to the people. In health and social care, our particular area of interest, the challenge started in the 80s with the Ottawa Charter, which introduced the concept of empowerment in relation to health promotion. The Canadians have always been a bit ahead of the Europeans in recognizing the importance of public health and health promotion compared to focusing on treatment of health. This charter was fundamental to the notion of the patient citizen moving from a passive dependent position to that of an active informed participant. And that's the whole notion of overturning or minimizing paternalism. But it has implications. Even now, there's a not total agreement about what empowerment means. So it depends where you stand. So the most conservative professionals, and it's hard to believe it, but it's a fact, simply think that empowerment means patients doing well by complying with instructions. However, for the better informed, more forward-looking, they recognize that there is good evidence that there are better outcomes if people are actively involved in their care, both in decision making about it and the actual delivery. But and again, in this cartoon, to help you read it, it says, "The patients know more about their disease than me. I must get faster modem, higher speed internet access than them." It's all about anxiety. Everyone feels anxious about change. In the case of these doctors in the cartoon, it's about their power and influence being undermined, and it's a very real issue. However, as I'll make the point in a minute, it's not just doctors. So if you look at the work that's been done since in the last 10, 20 years, we've established through policy work 3 main components that underpin patient empowerment. One is improved health literacy, and obviously Christine will talk more about that, so I'm just passing over it, but it's a crucial element. Joint decision making, and in chronic conditions, which after all affect a large part of the delivery of healthcare, the idea of better self-management with support from professionals. All 3 of them require a shift in attitudes from both sides, both bottom-up and top-down. People find change stressful. I can give an example very quickly. When I was a young doctor manager, too many years ago, I was busy with mental health patients, trying to set up a self-help group. And before the success criterion was met, which it was when they kicked me out because they didn't need me, the anxieties expressed by mental health patients was if they put their heads above the parapet, they'd be discriminated against. They were very fearful about what would happen if they shifted their position from dependency, but they did, and that's fortunately the way it's gone. Now, equally, the whole notion of health literacy is often presented as making the citizen more aware of their own health and more competent. But what is also important is professionals themselves need further training in health literacy. And indeed, it's one of the factors quoted by WHO as being underlying the problems that many governments have had in managing the pandemic is the lack of adequate health literacy on the part of politicians, not really understanding what the issues are. So this all leads to something which is central to my organization's mission, if you like, which is a more holistic approach to health and well-being. What it involves is a move out of the basically 19th century medical model of health and healthcare to recognize the importance of the psychosocial. And obviously that's a hint towards why we're looking at loneliness and the gray area between things that you would say are clinical illness and unhappiness and other factors. Equally, it's the notion of connectedness, the idea of health ecosystems, so that we recognize that you can't look at health and healthcare or even well-being as in a silo, but you have to include the influence of economics, the environment, education, culture, social cohesion, which is partly to do with social inequality, and it's the flip side of that. The next point I'd make was, until recently in health, the mantra was patient-centered care. Everything focused on the patient, until citizens pointed out, actually putting us in the middle separates us from the people who are involved in this. It somehow still makes us unequal. So that, as the next slide will show, we want to place the citizen as an equal participant in the co-production of social change. And this is a slide a Dutch colleague of mine has produced. And as you see, it puts community-based co-creation with the citizen as one of the members of the ring. So you see at the top, although it's a man holding something which doesn't quite, it looks a bit official, patient organizations and consumers are there in the ring with the rest of them, rather than separated and somehow diminished. So that's the concept, but it's not easy to attain. Moving from citizen or patient empowerment to community empowerment, this is the focus after all today. And as I say, from village to regional assembly, I spent 30 years living in a big city and then moved to a village 20 years ago. And I know something about village life and how important it is that, but it's a natural thing, social cohesion in villages. When our village was cut off by snow, it was amazing how people came out into the streets, talked to each other more than they normally do, looked after people in need and so on. It's part of normal social networks. The problem is size. And it's well known that the bigger the size of the group, when you get to a regional assembly level, there's a critical point where things like complexity of relationships, power relationships, and so on, start to complicate things. And it's one of the barriers to change. The WHO, again, has talked about community empowerment as the process of enabling communities to increase control over their lives. And communities don't necessarily mean just people living in the same place, but people who share common interests and so forth. So to conclude, really, the practical implication of this is community empowerment's more than just involvement, participation, or engagement of communities. It actually implies something much more active, community ownership, action that explicitly aims at social and political change. It's a process of renegotiating power in order to gain more control. And of course, if some people are going to be empowered, others will be sharing their existing power and giving some of it up. I showed that cartoon about doctors. I mean, it implies to all sorts of groups, but doctors need to learn. After all, I'm a poacher turned gamekeeper. As a doctor, I know perfectly well it doesn't need to be disempowering, sharing power. It's actually, it can be a very positive experience. It's just whether you have confidence in your own abilities and so on. Community empowerment then necessarily addresses the social, cultural, political, and economic determinants that underpin health. and seeks to build partnerships with other sectors in finding solutions. Again, that sounds like a very pompous statement, but it's it's a restatement about the importance of working outside of silos and making helpful connections. And that's true, for example, if you think about mental health. Mental health in the workplace, for example, something that Nikolai I know knows about particularly, is something that involves a lot of players rather than just simply the medical community. Okay, so to my final slide is another picture. It's the long and winding road. I mean, the fact is that this is something that doesn't happen quickly. We know that, and that although we're committed to the principle, because we know it will lead to good rewards by having a more balanced system with greater involvement from all sides. It'll take some time and there are a lot of barriers, but we can still, in the meantime, achieve a lot by local action and supporting each other. Thanks very much.
Thank you very much, David, for that really sort of useful overview and history, because I think, you know, we can all work in different sectors. We're very much based in the health sector, and other people are very much in the community and sort of local government and that sort of thing. And we sort of forget how all of these issues actually underpin each other and support each other. And you know, and you mentioned the whole thing around health literacy and how important that is. And I like the reflection that part of the issue we've got is actually the low health literacy of some of the politicians themselves. And that's a very useful reflection.